Okay. Yeah. Hello. So we're going to do a case-based discussion. For the purpose of the video, are you happy for me to share this for educational reasons?
Yeah, no worries.
Oh, thank you. Okay, do you want to fire away if you give me a case description? I'll take some notes as we go just for your portfolio log after, is that okay?
Okay, yeah, that's fine. So I saw a 22-year-old male that came in today after his third flare of genital herpes. He was looking to get some acyclovir to take home with him for any future flares. For his previous 2 flares, first he'd been seen in sexual health clinic in the UK and been given a one-off dose of acyclovir, and they'd given him some advice about or sexual health advice in terms of contact tracing and for future sexual encounters. And then second time he was in Spain, went and got some OTC acyclovir and had a bit of supply of that, so he's used the leftover of that to treat this third flare, and then had settled it down. He'd come in to look to get some better longer term management for future flares.
Okay, fine. How, you got some really good detail there from the patient off the bat from that. How did you find the consultation? How do you think it went?
It was a bit tricky at the start. He was quite cagey, not really wanting to talk about it bluntly, so he came in saying he needed a prescription. That was his opening line.
Okay.
And then he didn't know what it was, but he'd got it before and wanted to get it again, and then ended up finding out it was acyclovir, and the way he was being so cagey, he kind of thought that it was probably genital herpes. And then once I said the words genital herpes, he kind of started to be a bit more open with it, but I still say throughout the whole thing he was quite embarrassed.
Okay.
Yeah.
So if we focus on your communication skills, because that's something that you've done quite nicely there, you've got the patient in. Can you think back and think about the consultation and what consulting skills you might have used to get that information from him that he didn't want to divulge, and how you might have brought him along to kind of being able to give you the information as comfortably as he might have been able to?
I think, so yeah, like I said, initially you could sense that he was a bit embarrassed about it, quite cagey with all of his answers, but it started with open questions which didn't really work, and then I think my approach at that point, once I thought that it was genital herpes, was just to sort of address the elephant in the room, so that hopefully he'd realise that it's normal to talk about these things.
Yeah, okay. So you kind of normalised it to put the patient at ease.
That's better wording than I said, yeah.
No, your wording's fine. How did you think it worked? Because you said he was still a bit, like it's an uncomfortable thing for people to talk about. Did you feel like once you got that elephant in the room, you've acknowledged, let's just get this out, let's normalise this, I'm here, I'm a doctor, I talk about sexual health. Did you think then he was able to kind of open up a bit more or engage more?
Slightly, but not anything huge, to be honest. He was still sort of very minimal with details.
Okay.
I don't know if there was an element of well, he said in his initial sexual health appointment that he hadn't really got much advice in terms of managing it, and he didn't know the name of his medication. I'm not entirely sure he knew it was genital herpes initially. I'm not sure, but
okay.
I think maybe a big part of his embarrassment was maybe not knowing that much about it.
Yeah.
So I did try and talk through genital herpes with him a little bit, but at the end of the day, I knew that it'd be better for him to speak to a sexual health expert. So recommended that he gave SHIP a call, because I know that they do some like advice over the phone and stuff.
Yeah.
So hopefully you can get some more in-depth information from them.
Yeah. How, if we think along the kind of communication side of consultation skills still, how did you feel? Because it is sexual health and some people are more comfortable and some are less comfortable. How did you feel kind of navigating that consultation with somebody? Was there, and in amongst that, were there any dynamics that you needed to think about? Was he much older, much younger?
So he's a little bit younger than me. I think awkwardness was okay. I think generally if I think it's a slightly awkward topic for either of us, then we'll just try and like quite confidently say the embarrassing things. Do you know what I mean? I don't really like to like whisper, oh, how are your bowels? Because I don't know, it seems to be creating an atmosphere that it is something strange to talk about. So I just try and give in pretty direct. I don't know if that's a good strategy, but it seems to work for some people.
Okay. Oh, so how do you feel that it does work for you? Because I think it's a reasonable strategy, isn't it, to just call it out, make it clear, take away the taboo. Do you find that generally that works quite nicely for you as you as an independent clinician?
Yeah, I think so. I don't generally find that people... Well, I guess you don't know if people haven't divulged things to you, but I'd say most of the time it seems to get people to open up a little bit.
Okay, super. And certainly you got bolts of what you needed. Do you feel like you were able to open him up enough to safely manage the consultation through to a safe conclusion?
Yeah, I think so. So it was a bit clunky at the start, trying to work out why I was hearing things, but I think once that had been established and we started talking more about just general management, I think we spoke a bit about prodromal features and the use of like barrier contraception and prophylactic acyclovir if he gets to that threshold, and sort of with the acyclovir that I gave him, what to look out for and when to start taking it, and then again directing him to sexual health services for more information as well.
Yeah, okay. So you know about sexual health services. Do you know specific to Plymouth about sexual health services? How did you kind of navigate that bit of the information?
As much as all I know is that it's called SHIP, and I've been on their website a couple of times, but that's as far as my interaction with them has gone.
Yeah, okay. And so how did you give that information to the patient? What did you use to give him that info?
Probably could have done more, to be honest, yeah. So just told him about SHIP, the name of it, and that they've got a website and a phone number, but I didn't give him specifically the website or the phone number, so should probably do that in the future. Okay,
and so you might just kind of jot it. We've got different IT in different places as well, haven't we? So you might be able to just write that down on a piece of paper for him. Sometimes SHIP here don't have, but some places have QR codes that you can get the patients kind of scan directly as well. And you might notice in some of our rooms there are QR codes on the wall that were previous trainees' quality improvement projects. So there are different QR codes for different things that patients can scan. So it's maybe just in each place that you are, but we can talk about that in a moment, kind of ways to give patient the information. Let me just jot that down so we think about that one in a minute. But you were quite confident in generally what to guide the patient what to expect when they go to kind of any genitourinary service. You said you know that they'll offer phone advice in the first instance.
Yeah, and he'd been not to the Plymouth one, but he'd been to sexual health services in the UK before, so he had an idea of what to expect, and he had full screening done there, so he's had some interaction in the past.
Yeah, okay. And you sound like did you feel pretty confident in the management of this chap? How did you feel?
Reasonably confident, but purely because I'd had a genital herpes yesterday.
No,
so,
that was lovely.
Yeah. So
it's funny how they come in little themes, isn't it? Okay.
I'd had a read through nice and that, and had like a reasonable idea of what to do.
Yeah. What kind of resources do you have kind of things at your fingertips that you tend to go to as you go to sources for quick information in a consultation?
Nice CKS, the Devon formulary, GP notebook, DermNet.
You've got a few kind of...
I'm trying to think what else. Might have a couple of apps as well, but they're more cute stuff.
Yeah, okay. Did you do any, so you've navigated this chap off to ship, you've explained to him what he can expect from that. Did you do any prescribing or anything yesterday or today?
Yeah, so gave him some aciclovir to take home. So the 800 milligrams 3 times a day for 2 days as the rescue pack type thing when he's getting the prodromal symptoms. And gave him 2 packs worth of that, but said that he should get in touch with us if he's using any of them, just so that we can monitor his if he's meeting that 6 times a year threshold for prophylactic aciclovir.
Okay, good. So you've given him quite a kind of a comprehensive plan there. How did you share that with him?
Just verbally.
Yeah, okay.
Yeah.
Do you, and this is something we focus on more in kind of later stages of GP training, but did you kind of think through ways to check that he was fully on board and he'd understood the plan today?
No, I didn't think about that, to be honest. I guess other than sort of how much confidence I had during the consultation that he was taking the information. But I didn't ask him any specific questions like, how many of them would you take if you got, or what symptoms might trigger you to start taking it. I didn't ask things like that.
Yeah, okay. But so that's that. Those are. So if we were to think about from the purposes of what we've discussed so far, so some learning points from today. You've already highlighted one earlier on. Can you remember what you were saying earlier? So if we think now, as based on that case, some learning points specific to take away from it today.
So better forms for supplying patients with information or signposting, giving them written phone numbers, websites, or if there's leaflets, QR codes to access those resources, checking their understanding of the information you've given them with, I guess, direct questions.
Yeah. That seems reasonable. Yeah. That's kind of 3 learning points, isn't it? So if we think about kind of how do we check understanding, it can be it's a skill in its own right, and we all do it in different ways, and it'll be something to just kind of practice as you're consulting going forward, and finding the phrasing, the words that you feel comfortable with, because there's lots of phrases out there that you can kind of parrot, and you'll see as you observe lots of us doing our own clinics how we check a patient's understanding. Part of it's going to be helped by some of your learning points above that by giving them the written information. So having a piece of paper, using the online platforms that we've had, and hopefully we'll come back like at QRX, where we can text people directly the information for the ship's contact numbers and opening hours. Maybe actually giving him a written information sheet from something like patient.co.uk about genital herpes, which would then have some of those information points already bulleted in there. Yeah. Or on those websites as well, they do tend to have those QR codes that patients can then scan directly from your computer. I just always make sure that when I get them to do that, there's nothing patient identifiable anywhere on that screen that they're not. But so then they scan those QR codes and it takes them direct to the link, and then there's no pieces of paper going missing. So that's something I find quite helpful.
Okay.
So having that information that you've passed on to them, and then just playing around with the phrases to check the understanding, just saying, I've given you an awful lot of information there. Can I check you're happy with what we're planning today? Just remind me what we've agreed then from today, so that I can check that you've followed everything that I've suggested. So phrases that just get the patient to kind of repeat back that plan, so that you're really checking that they've picked up on it. Okay. But otherwise, overall, it sounds like it was a nice that you've just approached that case yesterday. You've gone away, you've identified your educational needs, you've already gone away and done the reading, and lovely to get to cement it again the next day by seeing somebody with the same thing and going, I knew exactly what I was doing. Did it feel like that to you in the consultation?
Somewhat, I guess, because it was fresh from yesterday. So. Yeah,
okay. Super. At the moment, do you have any other questions for me?
No, I don't.
Okay, fab. Happy with those learning points from today, but actually it sounds like you've done a really good job with that case.